For this Raksha Bandhan, offers will be given. This is for our government medical job aspirants.
Hello everyone, welcome to Nidhya channel. Let's start with today's MCQ discussion. The first question is, which enema is given in case of opium poisoning? And the answer is coffee stimulant enema. Why? Because during opium poisoning, already the patient is unconscious or drowsy. The patient cannot swallow enema by mouth. So we'll be giving it rectally. The amount will be as minimal as possible, that is 90 to 120 ml. Okay. So we give coffee stimulant enema. So here comes opium poisoning means what could be the antidote for opium poisoning? The answer will be naloxone. Let's move to the next question. Okay. Let's move to the next question now. The air bed or alpha bed is mainly used for the patients with burns and bed sores. Why? Because the goal here is to redistribute the pressure over the whole body premises instead of only the pressure premises. Okay. So what happens during burns or the bed sores? There will be excessive amount of the capillary pressure in the bony premises. So what will be our main aim is to keep the capillary closing pressure within 32 mmHg. Okay. So for that, air bed is given for the burns and the bed sores patient. Next question is, which is the primary source of data during assessment? Obviously, the answer will be the patient. Okay. Except patient, whatever the other options are there, family members, old records, and the healthcare workers will be the secondary source of information in the healthcare setting. Let's move to the next question. Thermogenesis or heat production is regulated by posterior hypothalamus. Okay. So the anterior hypothalamus is held for the thermolysis, which means heat loss, and the posterior hypothalamus is responsible for the thermogenesis. Medulla oblongata is responsible for the respiratory and cardiac center, whereas cerebellum controls the balance and coordination. Let's move to the next question. The greatest percentage of the body heat loss is through radiation. 60% of the body heat is lost by the radiation. So during radiation, how it happens means, whenever the patient is standing beside window or cold walls, the body will usually try to lose heat. So prevent the patient or the newborn from the cold surfaces. For that, provide radiant warmer to the newborn. And then, so this is one of the option where heat loss occurs without any physical contact. Whereas in the conduction, direct physical contact happens with the objects, whereas the body loses its temperature. For example, by cold instruments or ice packs or cold mattress, or whenever we keep a baby under a weighing machine. So what we should do? Try to pre-warm the surface. Okay.
Dream undi. Preparation ki direction kavali. Bro, I need proper guidance. కలలు కనండి.
ఈ రోజు మనం లెట్స్ ఫో గురించి నేర్చుకుందాం.
కలలు కనండి, సిద్ధమవ్వండి, నమ్మండి.
Join Nidhya Medical Academy and start your preparation now.
Warm the surface. Okay. So by conduction, only 3% of the body heat will be lost. Very less body heat will be lost by conduction. Where it comes to option C, convection, that is by moving air, like by fan or by the air condition, where only 15% of the body heat will be lost by convection. Whereas evaporation, we lose our body temperature by sweating or by wet linen or by wet skin after the birth. So evaporation occurs 22% of the heat loss. Let's move to the next question. Tertian malarial fever occurring every 48 hours is caused by Plasmodium vivax. Okay. Falciparum, Plasmodium falciparum causes quotidian, that is 24-hour or cerebral malaria. Plasmodium oval causes a milder, less common than the tertian. And then Plasmodium malariae causes the quadrant 74-hour fever. Now try to remember, the malarial fever is caused by the Plasmodial protozoan and it is transmitted by female Anopheles mosquito. Let's move to the next question. The apical pulse in an adult is best located in the 5th intercostal space, and for child it is located in the 4th intercostal space. We all know that we have 9 sides of the pulse and the normal pulse level is 72 to 100 beats per minute. Nowadays they write 60 to 100 beats per minute as well. So if it is less than 60, we call it as bradycardia, and if it is more than 100, then we call it as tachycardia. Let's move to the next question now. The primary respiratory center is located in the medulla oblongata and the secondary respiratory center is located in the pons. Cerebellum is responsible for coordination and balance, and whereas hypothalamus is responsible or regulates the temperature or hemostasis. Let's move to the next MCQ. The normal tidal volume is approximately, option is B, 500 ml. Now, what is tidal volume? The onset of air that moves in or out via one complete respiration, via one complete normal breathing is called as tidal volume. So, the amount of the air will be 500 ml. There are many other terminologies, that is IRV, that is inspiratory reserve volume, means the extra air forcibly a person is inhaled via one normal inspiration. Means whenever we are inspiring, whatever the extra amount we are taking it, the air we are taking, that is IRV, inspiratory reserve volume. The amount will be 3000 to 3300 ml. And then ERV, that is expiratory reserve volume, means the extra air volume exhaled after normal expiration is ERV. The normal ERV is 1000 to 1100 ml. Also, there is one more, that is RV, residual volume, means the air remaining after maximum expiration, that is 1200 ml. Now, sometime there will be a question about the vital capacity. So, how we calculate vital capacity? Vital capacity is calculated by doing addition of the total tidal volume plus inspiratory reserve volume IRV plus ERV, that is expiratory reserve volume, and the total amount stands for 4600 ml. And also one more term is there, total lung capacity. How do we calculate total lung capacity? So we add all the terms, whatever we have learned till now, that is tidal volume, IRV, ERV and residual volume. When we add TV, IRV, ERV and RV, the total lung capacity stands for 5800 to 6000 ml. Let's move to the last question of the day. Kussmaul's respiration, which is deep labored breathing with a fruity acetone smell, is seen in option number D, acidosis and diabetic ketoacidosis. This acidosis is metabolic acidosis and diabetic ketoacidosis. We see Kussmaul's respiration. Okay, the person will have air hunger, so he will take deep and fast respiration. Okay, there can be one more question about Kussmaul's sign. There are two things. One is Kussmaul's respiration, another is Kussmaul's sign. Kussmaul's sign will be seen in the patient with constrictive pericarditis, patient with cardiac tamponade, patient with right heart failure and patient with cardiomyopathy. What we'll see in Kussmaul's sign is increased jugular vein pressure during inspiration. In a normal person, whenever we are taking the breath, means whenever we are taking the inspiration, our jugular vein will not be visible or it will be down. But whenever the person is having right heart failure or constrictive pericarditis or tamponade or cardiomyopathy, we'll be seeing there will be bulge in the jugular vein. Okay, so there are two things. One is Kussmaul's respiration, another is Kussmaul sign. Kussmaul sign we'll see in the cardiac problems, especially in the right heart failure, and Kussmaul's respiration we see in the metabolic acidosis and diabetic ketoacidosis. Along with this, some other questions also we see. One is kinase stokes that we see during heart failure or stroke or dying patient. Another we see Stridor's respiration that we see in the upper airway obstruction or obstruction by any foreign body. So these are all were today's MCQs. Thank you so much for watching. Let's see you in the next video. Thank you.